The prevalence of prostate cancer within the UK is really very similar to that of breast cancer. Prostate cancer is also very strongly linked to age. Patients who are particularly at risk of prostate cancer are those with a family history. If you have a first-degree relative who has prostate cancer, then your risk is 2 to 3 times higher. Other group that is significantly at risk of prostate cancer are Afro-Caribbean men.
I have 2 brothers who have prostate cancer, fortunately not a very aggressive form, so I've been regularly checked over the last 15 years. And I developed it about 4 years ago.
PSA is a small molecule that's present in the blood of all men, and it tends to be increased with increased age of the patient, increased volume of the prostate, vigorous exercise such as riding a bicycle, and also any inflammatory condition which affects the prostate such as prostatitis or a urinary tract infection. But the PSA is also elevated in 80% of men who have prostate cancer. So very often the earliest sign that a man might have prostate cancer is having an elevated PSA blood test.
I was first tested at the Worthing PSA Test event in September 2016. I thought it would be routine, but I came up with a very high PSA reading and was pretty much caught just in time before it had spread out into the bones or the lymph glands. So 3 years later, I'm pretty much clear of prostate cancer, living a normal life, and tomorrow running a 10K race.
The PSA test is a simple blood test. It'll take somewhere in the region of about 2 to 3 minutes to have it done. It can be done at your GP surgery or in the hospital, and it can also be done at screening events which are held in a variety of parts of the UK.
PCaSO started PSA testing events back in 2011. All of the events that we now run ourselves with our own volunteers. About a week after your test, you will receive an email saying your result is in and ready to view online. We use a traffic light system. A green result means your PSA is in the normal scale. An amber result means your PSA is slightly raised and we advise you refer to your GP for a further test. A red result means your PSA is cause for possible concern and may need further investigation by your GP. Please don't panic if you have an amber or a red result, as 3 out of every 4 elevated readings are not caused by cancer.
It's important to realise that PSA is sensitive for prostate cancer. In other words, 80% of men with prostate cancer will have an elevated PSA, but it's not wholly specific for prostate cancer. But it does identify a group of patients who deserve a greater degree of scrutiny. And that scrutiny would normally take the form of referral to hospital for a rectal examination, for repeat PSA, and if necessary, an MRI scan.
Yeah, you was always at the back of your mind because you see it on the news a lot. If you get an all clear, you can say your peace of mind, and you can just I guess wait till next year and come back again.
It's excellent. It's really well organised, and I'm very happy I came. Yeah.
My advice to any man who's aged 45 or over is to know your PSA. Prostate cancer is a condition which is relatively slow growing. In 80% of men, it is associated with an increased PSA level. Knowing your PSA will allow you to track the trend of PSA in the future. If it's elevated outside your normal age-adjusted range, then it gives you the option of having it investigated. And it's much easier to work from a stance of having information that is concrete rather than putting your head in the sand and hoping that all works out well in the future.